Good morning. I'm Dr. Cedeno, board certified dermatologist from Houston Dermatology and Plastic Surgery. Today I'd like to talk to you about pigmentation. Okay, pigmentation disorders are extremely common in certain populations, mostly Mediterranean, Hispanic, African American, and Asian. These special populations require a lot of knowledge about the pathogenesis of these conditions and how to treat them. So there's multiple different conditions that can lead to brown spots on the skin. I want to say the most common type of pigmentation is called melasma. It has a hormonal, a genetic, and an environmental component to it. So it's more common in women because of the role of hormones, which in most circumstances we cannot control. The genetics obviously cannot be controlled either. So we have a few elements that we can control, and unfortunately this type of condition is extremely stubborn and tends to come back. There's also different other types of hyperpigmentation, like lenticos or lentiginous, so freckles or liver spots that we see as we age. These two types of pigmentation come mostly from sun exposure, chronic sun exposure in individuals that should not be getting that type of exposure to ultraviolet light. So in all of these types of pigmentation, the most important element is protection. So sun protection with a broad spectrum covering ultraviolet type A and type B, and also natural light is the way to go. So we have multiple different ways in which we can protect our skin, from sunblock that comes in serums and sprays and creams, down to sun protective clothing, a large brim hat, and even now there's some supplements from fern extract called Polypodium leucotomos that can minimize sun damage. As for other ways in which we treat pigmentation, we have lightening agents like kojic acid, arbutin, we have azelaic acid, and mostly in our practices in the United States we use hydroquinone based products. Unfortunately, hydroquinone, if we use it at high percentages or we use it for many consecutive months, can lead to even more pigmentation, and rebounds with hydroquinone are extremely high. So you have to go to a practitioner that knows how to manage this lightening agent. In my practice, we also use retinoids. We also use chemical peels with glycolic acid and lactic acid. The Gesner peel, we use pyruvic acid. So we have a large variety of chemical peels. The VI peel, for instance, that has helped a lot of my patients. We also have lasers. So lasers need to be used very carefully, especially in special populations, to prevent what's called post-inflammatory hyperpigmentation. So lasers that can be used in the office need to be used in a very careful way and with appropriate screening and selection of patients. But there are lasers that can help out. And lastly, an oral medication that is now very commonly used in Asia called tranexamic acid that is blocking one of the vascular endothelial growth factors that can lead to melanin production. So there's a huge array of different types of pigmentation, and I encourage that you come in for a consultation or you go to your dermatologist and discuss your issues in depth, because there's no magic cure and there's no single treatment that can help all of them. If you have any questions, please try to engage with us via social media. We'd be more than happy to help. Have a nice day.